my name is Anna and I'm an Advice Session Supervisor at Citizens Advice Wokingham. My role is to support the volunteers as they take calls from the public on their different issues and the help that they need. We have between, I'd say, roughly about 30 to 40 volunteers a day, maybe more actually, to support, all taking calls in from people about different issues. So it could be issues like prescription help, to collect those for people who are self-isolating because of the coronavirus. It could be people who need referrals to the food bank. And it could be employment issues, people who aren't sure whether they have been furloughed or not, and people who have lost their income, perhaps people who need help with benefits. So all different issues that people are taking in calls about. So my role is to support the volunteers in that, to help them answer questions, to give them any advice they need, to help them to record things well on our system, and just help them with the various systems that we have going on. We're all working from home, and I've never worked from home before. It's an education, it's different, and of course we all have to communicate with each other, so we do that through Google Hangouts, and it's hectic, like all the time. You're on all day. But it's really good. It's really good to be able to work together as a team and just support the people of Wokingham with their problems and all the help that they need. So what else do we do? So every morning starts with briefing, and that's what I'll be doing in a few minutes. So that is just getting the team together on Google Hangouts, and we just talk about the day, who's going to be doing what that day. Any news that people need to know about, any changes perhaps in the law, any changes in our procedure, anything that happened the day before that people need to know about, the priorities of the day and the priorities of the week. So we're doing that briefing in a minute, and we'll just see how the day goes. Okay, so it's 11 o'clock and I've just stopped for a very quick break. So far we've had quite a few food bank voucher referrals and quite a few referrals for prescriptions for people. We've also had a query about employment. So someone phoned to say they'd literally just been fired, and the employer hasn't given a reason. They're refusing to furlough this person, and they want to know their rights and what they can do. Obviously now they've got no job, no money. Fortunately, we have a brilliant employment specialist who has drafted a letter that we can give out to clients to set out their rights to their employer, and give government guidance on furloughing and the rules around that. So we're going to give him that, and we're also going to give him advice on his employment rights as well. We've also had a query, very urgent query from someone in a domestic abuse situation, very fearful. So the coronavirus and the self-isolating has really heightened this problem, this domestic abuse problem. So we're going to help them. We've given them various pieces of information. We've also got solicitors who can provide initial free advice as well. So we're going to help her with that. There's lots of queries. It's been very busy morning so far, and so now need to quickly get back to it. Okay, it is now 3:39, so we've had a quick lunch, and dealt with many more issues coming in through the phones on our advice line. We've had quite a few food bank referrals, prescriptions, absolutely loads of those have gone through, as well as answering queries on debts and benefits, and employment. These are all things that we've been helping with this afternoon and this morning. But probably what stands out, and I think what the volunteers are really good at, are sorting out those really odd issues, the problems that people have that are just really unusual, that would stump most people. So we've had a lady who has an appointment with the hospital tomorrow. She's an older lady. She cannot use the phone. She has no idea if her appointment is going ahead. She has no idea if she's getting there, how she's going to get there, and she has no idea who it's with. So we've been trying to sort that out for her, and it's been all sorted. So yeah, just really unusual things, kind of exacerbated by the situation, exacerbated by self-isolation and people not being able to go through the normal routes that they go through, and the normal channels. There's been another case of a man with mental health issues, and he is about to run out of gas and electricity. He has a problem situation around him with his neighbours. His partner's moved out. There's nothing in his name, and he doesn't have any cooking equipment, and he's just really in a bad way. And these are really difficult things to sort out, but we've managed to move him on. We've managed to move him forward and contact the right people for him. So I think this is something that volunteers are just really good at, these difficult situations. So there's still about an hour and a half to go. So we'll see how the rest of the day pans out. So we've come to the end of the day now, and I'm just looking at the figures, our advice line figures, and it looks like we've answered about 78 calls today, which is a really, really high number. And according to the sheet where we record everything, all the phone calls we make, it looks like we've helped about 157 people at least, with all their different issues today. The volunteers have been really, really good dealing with all these different issues, and coming up with innovative ways of solving their problems. Yeah, it's been really busy, hectic day, but a very good and productive day. So we'll see what happens tomorrow and what tomorrow brings.